Yawa and Segal, and good afternoon, Reen, and to everyone listening in this afternoon. I hope that you and the community continue to do well at this time. I do want to say happy St. Patrick's Day to you and all of the listeners. As always, Yamagoa to yourself, Reen, and CKON for providing time for me to update the community today. As you mentioned, today we're going to provide an update on the COVID-19 vaccination for the community. It's now been a year since we've declared a state of emergency in Akwesasne, as well as a declaration of a global pandemic in which the world we live in. The 1-year anniversary for our declaration was actually yesterday on March 16th. I'd like to give a quick update on some of the rundown of the COVID cases in our area. It's always important to know what the current active cases are. Franklin County, as of yesterday, is reporting 130. St. Lawrence County is reporting 110 as of March 16th, yesterday. Eastern Ontario Health Unit is reporting 165. Cornwall is reporting 87, and the Mohawk Council is reporting 4. St. Regis Mohawk Tribe is reporting 5. Now, these are all active cases as of yesterday. And remember, they all continue to be active until they're considered resolved by a healthcare provider. And again, we currently have 4 active cases within the MCA's jurisdiction. As well, we extend, as always, our best wishes for a speedy recovery to all those being infected. We also extend our appreciation to those who are in isolation and quarantining to prevent the further spread of COVID-19. As well, I want to extend my deepest condolences to all those who have lost a loved one since the last time we updated last month. The community quarantine program is designated for community members who have no assistance or resources to help them throughout their quarantine or isolation period. For anyone residing in the northern portion of Akwesasne who is currently in quarantine, we ask that you please call 1-800-840-4208 or 613-937-4322. This is to receive basic food, supplies, and essentials, and it'll be delivered to your home and confidentially and with zero contact. And again, this is for people that don't have family members or friends that can assist them with receiving the essentials or food basics during their quarantine or isolation. There are now at least 3 variants of concern, which also may be referred to as VOCs, which are mutations of the original COVID-19 virus. They exist due to the virus circulating in different areas in population. The more a virus circulates, the more opportunity it has to change or mutate. There are concerns whether or not the vaccine will work against these VOCs. As of March 14, 2021, there have been 1,030 cases of the United Kingdom's or the UK variant, 44 cases of the South African variant, and there are 34 cases of the Brazilian variant that have been reported in Ontario. Evidence shows that these 3 variants are more contagious than the original COVID-19 because the variant can transmit to others much more quicker. There is ongoing research for the vaccine's effectiveness on these COVID-19 variants. It is deeply concerning that as there is now a new potential for a 3rd wave of these variants. However, despite the growing number of variants reported in Ontario, the COVID-19 vaccine is still highly recommended. On March 1st, our Department of Health announced that we received confirmation from the Eastern Ontario Health Unit of a COVID-19 variant or a VOC of concern, VOC, within the jurisdiction of the MCA. The Public Health Ontario screens all COVID positive tests for the presence of a mutation. Individuals who have tested positive for a COVID-19 variant have been in isolation and are following the community health guidelines. On March 2nd, it was further reported that the variant of concern confirmed in our community is South African variant. As a reminder, to reduce our chances of being infected or spreading the COVID-19, we ask everyone to please thoroughly wash their hands with a sanitizer and use soap and water and wash them for at least 20 seconds. Do not touch your eyes, nose, or mouth with unwashed hands. Make sure that you and people around you are following good respiratory hygiene. Wear a mask or other face coverings in all indoor public places. Maintain at least 2 meters or 6 feet distance between you and others. Avoid or limit activity that would put you in contact with anyone outside of your household. Stay home and self-isolate, even with minor symptoms such as a cough, cold, mild fever, and stay there until you recover and have somebody bring you supplies. If you have questions or symptoms, our community health is always there to answer, and they're also there for pre-screening for COVID testing if need be. If you are awaiting a COVID-19 test results, it's extremely important that you continue to quarantine for as long as the healthcare provider advises. And do your best to stay up to date on the latest information, but be sure to obtain information from trusted sources. We must all continue to work hard and keep ourselves and our community safe. So all these precautions we reiterate every month, but they're extremely important in slowing the spread into our community and to our loved ones. The Department of Health is proud that many community members in both portions of Akwesasne have chosen to receive the vaccination, which is greatly assisting to stop or slow the spread in our community. To pre-register with the Mohawk Council, we ask that you please call the community health nurses at 613-575-2341. The vaccines we've received are made by Moderna. They are administered in 2 doses. Once the initial vaccination injection is given, it is followed by a booster injection given 28 days later. It's important that you receive your first dose, followed by the second dose, in order to reach the optimal effectiveness of 95%. Following this schedule, this level of effectiveness is reached within 42 days after receiving the first dose. So it's vital that you receive the first dose of vaccine and continue to practice all safety protocols, avoiding groups, continue to social distance, wash your hands frequently, and wear a mask. At this time, the residents of both of our long-term care homes, Junkanusade and Yakisuta, have been vaccinated. These individuals were our first priority. Vaccination clinics for our community members began on March 8th, after we received confirmation from the Eastern Ontario Health Unit that, in line with the vaccine priority framework developed by the Department of Health, and the list of individuals have been pre-registered. To date, 549 have been vaccinated, with 60 more vaccinations scheduled for today. This includes residents and staff of our long-term care homes and members of our community aged 65 and better. That's the 349. In line with the priority framework, we are now vaccinating those aged 64 and under, including essential workers. The Department of Health is looking to hold additional vaccination clinics on Monday and Wednesday, as well during the evening and weekends, in order to keep moving forward and get everyone vaccinated. There are currently about over 300 people still on the pre-registration list, and I've just received confirmation from the Eastern Ontario Health Unit that we've received an abundant supply of Moderna to vaccinate the entire community of Akwesasne. If you are interested in receiving a COVID-19 vaccination, again, please call the community health at 575-2341 to pre-register. The community vaccination clinics are by appointment only. If you have an appointment to receive a vaccination, walk-ins are not being accepted at this time. After pre-registration for the vaccination, community health will call you to advise you of your appointment time and place. The date of your appointment, you should take your regular medication, eat your meal as usual, not wear scented products, and wear clothing that will allow easy access to your arm for vaccination. It's important that you not arrive more than 10 minutes early prior to your appointment, and it's best that you arrive on time of your appointment. Safety protocols must be followed during your appointment, and you should be prepared to show photo identification to confirm your appointment. After you receive your vaccination, you'll be asked to stay 15 to 30 minutes to monitor for adverse effects. While the number of vaccinated community members continues to rise, safety protocols must continue to be followed. It will be a long time before we have what is being referred to as a herd immunity. This happens when a population is immune through immunization or previous infection. We definitely prefer to have immunity from the vaccination and not through infection. It's been reported that 70 to 90% of the population needs to be vaccinated in order for the herd immunity to be effective. MCA is working hard to ensure that all community members who want to be vaccinated will be vaccinated. We want to get to the point where Akwesasne has reached population immunity, and it's important that everyone knows that receiving the first dose of the vaccine is not the end goal. It will take 42 days from that point for each individual to achieve the 95% vaccine effectiveness. And we also need 70 to 90% of our whole community to be vaccinated to be truly protected. Throughout this process, everyone must continue to wear a mask, maintain the 2-meter distance from others, and when in public, and avoid physical or large gatherings with anyone from outside of your household. I do want to reiterate that the vaccines are by appointment only. If you have called in and you are on the waiting list, we will get back to you. The community health nurses are working as diligent and quickly as possible to ensure that those who have registered will receive a call back and an appointment date. Reen, that's everything that I wanted to update you in the community this afternoon. A little bit shorter than usual report, but I think it's important that we share this important information on the vaccine rollout with our community. As always, I'm prepared to take questions from you and our community.
Excellent. Thank you very much. Again, that's Grand Chief, Mohawk Council of Akwesasne, Grand Chief Abram Benedict, talking about the vaccination and looking at the Mohawk Council of Akwesasne as a whole. So if you have any questions, you have to call the station at 518-358-3427, 613-575-2101. So continuing on, we'll start off looking at the Red Cross. I know that we pulled in some Red Cross workers to help with Akwesasne and also with Akwesasne. Are we looking at pulling in any Red Cross workers to help us with the distribution of the vaccination process?
Yes, absolutely. Yes, so as you mentioned, we did, the Red Cross came in to assist with the 2 long-term care facilities. They still continue to assist at Akwesasne and Chisnaitne. We are in conversations with them to see what supports they can provide for the community vaccination clinics.
Do you guys accept volunteers to help with the distribution right now, or are we not at that point at all yet?
We're not at that point yet, but if and when we are, we will inform the community that we are looking for volunteers. But having said that, there still continues to be a shortage of nurses and PSWs for the general operations of the MCA. If there are any interested, healthcare workers, we are looking for additional supports for our regular services as well, which would be also for our vaccination clinics.
Now, talking about the border, I know that a lot of people are concerned about the reopening of the border. What have you been hearing on your end? Are you in contact with CBSA weekly or monthly, or how have those updates been going with U.S. Customs and CBSA on the possible opening of the border? I know Trudeau and Biden have a bigger role in that, but is anyone hearing anything at all?
At this point, there's been no definite date provided. We do meet regularly with the Canada Customs locally and U.S. Customs locally as well to discuss and receive information related to the operation of the border and the pandemic and the impact of our community. There have been some conversations, or questions in the media about, is the border restrictions going to change for persons that have received vaccination? Because as you know, right now, non-Indigenous people, or non-Akwesasne, are required to provide a negative COVID test when returning to Canada. So people have asked, well, now that we're vaccinated, do I still need that? As of right now, it continues to be that. So there's lots of conversations around what after vaccination. But as related to the border, there has been no definite date set yet. Canada is a bit behind the United States as far as overall vaccination process. So that is a consideration I'm sure that they have, have to take in place of making that decision. But as of right now, we have no definite date for a reopening.
Now, you mentioned that we're getting the Moderna vaccine for our community. Is that something that we're going to stay consistent on, or in your talks with the Eastern Ontario Health Unit, have there been any talk about, switching to another one of the vaccines, maybe midway through, or do we just have to get what we get kind of deal?
So we have been assured that there's more than enough Moderna at this point for our community. The Eastern Ontario Health Unit is using some Moderna, mostly Pfizer, but Pfizer is a bit more difficult to handle, requires some special handling so that it's administered correctly and that the shelf life continues to be maximized. So we will be only for the foreseeable future administering Moderna in our community.
Now, looking at the reopening of the Mohawk Council of Akwesasne, did we still follow the March 15th? Did that happen? How are we doing with that process?
Yeah, so as we had previously reported, March 15th would be the reopening date. That was this past Monday. The MCA's is back open to the public, but all services, we ask that you please make an appointment to be able to access those services. If there are individuals who are seeking to get certain forms, see somebody, the buildings are open. We just ask that everybody acknowledge and accept that we do screen for individuals coming in, which is checking a temperature as well as answering a few questions related to their health to make sure that they are not at risk to the to the staff and others. But as of right now, yes, the MCA is reopened to the public. Services have always been provided just at different ways, or may have been reduced, but any community member wanting to come into the facility is able to do that as of this Monday.
And with regards to the travel radius and the curfew, where are we with that for MCA? And with the vaccinations that are, occurring now, are we looking at lifting that or extending the travel radius?
As of right now, the travel radius continues to be the same, which is 100 miles or 160 kilometers from the community. We continue to reevaluate that every week. As well, their community curfew continues to be in place from 11 p.m. till 5 a.m. At this point, we do know that Ottawa is possibly heading back into the red zone. Montreal still continues to grapple with, their rise in cases. The VOCs are a real concern now for our community and the surrounding communities. So the travel radius and the curfew have not changed. They will continue to remain in place. We evaluate that at least, once a week. At this point, we don't have a set date as to when that would change. We really are at a bit of a critical state where we need more people to be vaccinated before we can have some reprieve on, some of the measures that are in place.
Now, with regards to food distribution under the Mohawk Council of Akwesasne, I understand that that's going to be resuming. What kind of information do you have on that?
Yeah, we currently launched it's a food pantry program. It's being ran by the Department of DCSS, which is Community and Social Services. There is some additional information on our Facebook page. These are not the same as the emergency food packages that we had been doing during the beginning of the pandemic. This program is more of it is a subsidy for those who are in need of some of the food essentials. This is a food distribution. We do, unfortunately, I don't have the number offhand, but if you do call one of the MCA main lines and ask for the food distribution, they'll put you through to the program, and you can sign up for distribution.
Now, with regards to the recreation centers, are you utilizing one for the vaccination process? And if so, are we going to be utilizing the other two for the same process, or when are they going to be reopened to the community for their actual recreation purposes?
Yeah, so for the foreseeable, the recreations will continue to remain closed. We are using the Ganadigo recreation for the vaccination right now. As we look at planning for more, the other recreation centers will likely be utilized as well for vaccination centers. So we don't have a set time as to when they'll be reopened, but those will be the facilities that will be used for vaccination on Cornwall Island and in Snai. It is happening right now in Ganadigo.
Now, with regards to the AMB schools, where are we with that process? For those that might not have children in the local schools, might not be familiar with it, what's happening with our AMB schools?
You know, as of right now, AMBI is all full online learning. So the previous two in September, they had done what they called the hybrid model, which meant that the children were 2 days in the school and 2 days online. Some parents could have opted to do all online. As of right now, since we had a surge in cases and the parameters changed with the number of cases around in our community and in our community, which I believe was in November, we went through online learning. Scheduled for April 5th, which is in 2.5 weeks, the schools will go back to the hybrid model. So meaning that children will be 2 days in the classroom, 2 days online. That's the tentative right now. Provided that our cases in the community don't spike at any point and our vaccination continues to roll steadily out, that'll be the date.
All right, so for individuals fully vaccinated, is there still or restriction on travel, and if so, why? So I know we touched on the travel radius. So for individuals fully vaccinated, is there still a limit or restriction on travel, and if so,
mm-hmm. There still continues to be the same restrictions applied to everybody. That is the travel radius as well as the curfew. At this point, we haven't achieved enough vaccination in our community to remove any of those requirements. It's the same as masking as well. We already know that even after vaccination, we'll be wearing masks, unfortunately, for, the foreseeable future to protect ourselves and, our community. This is always rapidly changing, though, as far as, what is life after vaccination. That hasn't been established yet. Can we continue to receive questions about that? We just need people to exercise patience. As we get more people vaccinated, we will see less of those restrictions more of the restrictions will be lifted as more people are vaccinated. So stay tuned.
It's looking at Grand Chief Abram Benedict from the Mohawk Council of Akwesasne. We're talking about the vaccination rollout and any other items that community members have questions on with regards to the Mohawk Council of Akwesasne. So looking at another question, they want to know, why has the vaccine rollout in Canada been so slow compared to the United States?
Yeah, that's a very interesting question. There's a lot of dynamics around that. Canada, the government of Canada has been responsible for procuring the vaccines themselves from Moderna or Pfizer. Now they have AstraZeneca and Johnson & Johnson that are candidates for two of them are candidates for vaccination. So the federal government has been responsible for purchasing the vaccines and distributing them to the province. There has been, some delays within the company of making them. In the United States, they have the capacity to make the vaccines right in the country. Unfortunately, Canada doesn't. They are testing some other possible vaccines to be able to increase that supply, but that was one of the main contributors, was the delay in the government securing supply and the logistics of getting it from overseas to Canada and then distributed on top of delays from the manufacturer. So it's really something that's highly out of our control, unfortunately. But we've been assured now that there's a steady supply available within Canada, and we've received assurance that there is adequate number of vaccines, of Moderna vaccine for Akwesasne, that the Eastern Ontario Health Unit is holding for us on and available on demand.
Now, do you suspect or expect a return to normalcy? For example, they're asking kids returning to school, office workers back in the office. What are your thoughts on that?
I think that we're still several months away from all of that. Hopefully by September, that the children will be able to be back in school entirely. Provided that all of the the supports and the teachers have been vaccinated. We're really concentrating now on bringing the hybrid model back in. Hopefully by September that we have the herded immunity, and we can renorm, start some semblance of normal. As far as the office staff go, we have to continue to monitor and evaluate. We don't want to have any outbreaks. Outbreaks are extremely dangerous because they can spread very quickly. Here at the Mohawk Council, while sometimes it's a real pain in the butt to have our buildings broken up all over the place, admin 1, admin 3, housing, the Junkanuside, that's been a bit of a saving grace as well, because if we were all centralized in one big office building, it would make it much more difficult to have our services continue to be provided. But considering that our buildings are all broken up, it's made it logistically a little bit easier to have people in the office. But there's a lot of things that we have to consider when we bring all staff back into the building to ensure that they're safe, and that the community is receiving services that keep them safe as well. So back to the original question, or is it in the next few months? We're likely into the fall that there's a projection, and that's hopefully provided that the vaccines continue to provide immunity against variants as well.
Now, are we going to have to get another vaccine in 6 months or a year? What's the talk been on that you've heard?
That I have not heard too much about. Hopefully we can get our doctors back on the show, which I really appreciated all of those women for coming out and doing a show with yourself, Reen, and sharing some of that medical information. But on the briefings that I have been on with the Eastern Ontario Health Unit and other First Nation organizations, there has been not a whole lot of talk about that. If this is going to be an annual vaccination, that such as like we used to do with the flu shot, that I'm not aware of at this time.
Now, do we have to pay for the vaccine from the Mohawk Council of Akwesasne, or does the federal government cover that? Who covers paying for the vaccine?
The federal government is paying for all of the vaccines. No person in Canada is paying for vaccination, whether Indigenous or non-Indigenous.
Okay. Now, how will the coronavirus impact the upcoming MCA election in June?
Mm-hmm. So this falls under the CEO, who has been appointed by our executive director, appointed the CEO as to run the upcoming election. From the information that I've got, they are looking at ensuring that the processes taking place are going to be safe and accommodating to the health directives, which is, the social distancing, masking, etc. No, large numbers of people in one place. So they, from my understanding, are making those modifications to, or not modifications, but ensuring that those accommodations are going to be done on the election day.
Will children be required to have the COVID vaccine in order to return to school?
I think that we're pretty far off from even being considering that. All of the vaccines that have been approved by Health Canada are not for anybody under 16. I believe that Moderna has now begun testing or monitoring and testing of people or children under the age of 16, but this will likely be several months. I mean, if we're going to arrive at a position where you have to be vaccinated, it will not be in the next few months. It will be probably, years if that's what's being recommended. Then again, we'll have to take into consideration if that's going to be appropriate for our community or not.
All right, what individuals from our sister communities, Ganawage, Tyendinaga, Ganasadage, if they've received their first dose of the vaccine, do they still have to quarantine for 14 days?
Yes, they do. So all of the directives for quarantining, travel radius continue to be in place, regardless of being vaccinated, first shot or second shot at this time. Now, again, as we roll out more vaccinations to the community and more people get vaccinated, these restrictions may be modified, altered, or removed.
I'm 16. When can I get a COVID vaccine, and am I a priority?
So at this point, I don't know, the 16 and under is, there's no vaccination available for them. 16 and above, if we put it into the priority matrix system, it's that age range is down a couple tiers. But I would say that if there are individuals or younger folks with their parents' consent that want to get signed up to call the community health nurses, ask those questions of them, and get their name on the list. It's really important, regardless of what age range, that we get people signed up for the vaccine. As I mentioned in my report, we have about 300 pre-signed up right now. There obviously was more. That number is getting, is coming down because they're getting vaccinated, or people have gone and got vaccinated other places. But we need people, community members who are interested, to please call, ask those questions if you have them, and get on the list if you feel it's appropriate.
One comment from a listener: why are the health facilities still open and employees still working when we can't access the services there?
Well, as we've discussed in the past, a lot of services have gone remote. If there are, services that can be provided via phone, via Zoom, or whatever remote platform, those still continue to be the first preference of delivery. If there are services that need to be done in person, they are their directives is that that they're exercising all of the necessary precautions, health directives, observing the distancing, masking, etc. If there are some services that are not available, I would encourage the community member to reach out to one of the management team for that program and ask, what's the delay, or what's the status, and hopefully they can find a way to access that service. We really don't want to be denying services to anybody, but we also have to make sure that we're doing it safely.
All right, how are we doing with the fiber laydown in SNI?
SNI, so the project, which I might add before I give an update, we are having our general meeting next Thursday. So any individual community member who wants to observe or participate can email meetings at akwesasne.ca, or can call our office and ask for the information to either call in, or it is on the Zoom, or how to access the Zoom. We will be providing an update at the general meeting next Thursday on the Fiber to the Home project, as well as the homelessness project, the food distribution or food pantry project. We're providing an update on that as well. So we had started SNI as the first area for what they call boring, which means drilling underground, to be able to put the conduits in to access every home. So instead of hanging the fiber on the telephone poles, they're running them under the ground and running them along the roadway. So SNI has just about been completed for that process, at least laying the conduits. Now they'll be coming in a few weeks into Ganadigo and doing that as well. that is that's one part of it. Then they now have to run the fiber line as well, and then begin kind of the connection points. It still is several months away from having the high speed in SNI, but I encourage community members to listen in at the general meeting upcoming to receive an update, or as always, our general meetings are recorded and shared on our Facebook page and our YouTube page for community members to view after the fact of the meeting. So there will be a more comprehensive update on that coming next Thursday at the general meeting.
Now, what about lacrosse? Are we going to be able to open up the arena to lacrosse or any type of sports or events or things like that? Where are we with the Otnolagoa Arena?
Unfortunately, at this point, there is no plans in the very foreseeable future to open indoor sports at the arena. That doesn't preclude outdoor that may be able to occur, but we're not at the point right now that we're comfortable with being able to open the arena back up for community usage for indoor sports.
We have another one here. When will in-person district meetings resume? The community member feels that Zoom isn't drawing in many community members. Even during the general meeting, not many are attending.
Yeah, well, attendance has always been a bit of a struggle in person as well. I can assure you that. But there has been no date set yet for district meetings. It is something I can take back to the district chiefs and discuss with them. In person, we're really not in a position to have in-person meetings at this point. The recreation centers are closed. Even though there may be not many people attending, that's not a controllable as well. I mean, you could have a district meeting and have, a lot of people show up, which would be great. But in the case of having to social distance, wear masks, there are limits on the building capacities. We're not there yet. I know that, believe me, all of our meetings are done on the Zoom. At first we were like, oh, this is pretty cool. We can get a lot more meetings in because we don't move very far. But everybody is, saying, okay, we need to have in-person meetings, especially some, negotiations and things like that. Just are not the same over the Zoom or Teams or, things like that. So we're not there yet. Hopefully in the fall, as more people get immunized, we'll be in a better position, more safer position for us to be able to have in-person meetings.
All right, so spring is here, well, almost. And the roads have been a little bumpier because of the thaw and things like that. How are we with our roads, potholes, fixing things? Laying new pavement? Where are we there with our roads?
Yeah, so I know that Wade LaFrance road in Akwesasne continues to be a priority for us. In the fall, we had done some preparation work there for this coming summer or spring to be able to move that project forward. There are other roads within the community. I know that Hilltop here in Ganadago is a bit rough as well. A number of streets actually, in fact, in Ganadago are quite rough. So they continue to be on the priority listing. The Wade LaFrance is on the top of the queue. Our members of council have been having regular meetings with government officials talking about the priorities, road priorities. We do have an upcoming meeting with the province of Quebec to specifically talk about that. So, we hear the community, is concerned or upset about the conditions. We are doing the best that we can to ensure that we are rolling out construction projects for either the fixing or resurfacing. But right now, those efforts are all underway, and hopefully by this spring we can have some of the roads fixed.
We have a comment from one of our community members. They say, why is it easier to get services elsewhere in Cornwall and other places than it is here? This person feels that our healthcare system is letting community members down.
Well, that's very unfortunate that somebody feels that way. what we do have here in the MCA is a service complaint policy, or a service complaint process and policy. If a community member feels, any community member, and it doesn't have to be health, any service that the MCA provides or is not providing adequately, has provided terribly, has done well as well. We do like, thumbs up at when we are doing a good job. Please reach out to the administration of the MCA and ask for, how do you file a service complaint. Those complaints are sent to the executive director, who then directs the director or program manager for review and a report back, as well as reaching out to the complainant or the community member. I don't know what specific service a community member may be referencing to. I do know that, all of our health staff in all levels are helping at various levels. They're trying to, combat and slow the spread of the COVID-19 virus. There's a lot of staff that have been working, day in and day out to ensure that our community is safe. And sometimes as a result, some of our services do get affected by that. But, we are doing the best that we can to ensure that the supports are available for our staff, and to ensure that community services are minimally disrupted in the course of, keeping our community safe during this pandemic.
You referenced when we asked about the election, you referenced chief electoral officers, or a new person that's been appointed. You mentioned that by the executive director.
Yeah, Leona Benedict has been appointed as the chief electoral officer.
All right. So looking at the Akwesasne Community Settlement Trust, we know that it's separate from MCA, but we talked, I think the last time that you were on the radio, with regards to checking into it to see if there was some possibility of utilizing funds from the settlement trust, whether that's actual funding or interest off the account or investments or what have you, for some sort of type of, I guess would be equal to a stimulus payment for, residents under the jurisdiction of MCA. Have you explored that? And is there any news on that front?
Yeah, we did report back last month on this a little bit. There is a pot of money that has been set aside through the Community Settlement Trust, known as a disaster relief funding. There is not a whole lot of money available in there right now. There is some criteria that the MCA would have to, well, actually, it would only be the MCA would have to meet to access that money. The only one challenge is, though, is that the way this trust has been designed, there isn't direct stipends is not allowed. So we wouldn't be able to access, $1 million and then turn around and provide the community with, X amount of dollars as a result of that. It has to be through programming delivery, or, through whether the MCA or another organization. That's the way the trust has been designed. So there's not a whole lot of money in the disaster relief right now, and we wouldn't be able to access it as a direct stipend to the community. It would have to be the form of program, or, we do access the trust for the heating assistance program, which provides, some monies to the heating provider for the community members' benefit. In fact, last week we announced that council approved an additional allocation for the community, knowing that this year has been extremely different than previous years. The heating costs never seem to go down, but this year we're spending a lot more time in our homes, which result in additional costs to be in our home. So the council approved an additional allocation last week to help with those heating assistance for our members. And through that process, anybody that had previously applied and been approved automatically got the additional allocation for this year.
Does Mohawk Council of Akwesasne provide any funding for funerals when it comes to laying your loved ones to rest? Sometimes that can be a struggle, especially if you've got more than one family member who, passes away at the same time. are there any type of services available for that purpose of helping with funeral costs?
Yeah, no, absolutely. This is obviously a very challenging time for all of us, and especially losing a loved one during this pandemic has been extremely difficult. Not being able to gather, not being able to console our family and friends, but also related to that, yes, there is a financial impact to the family. So the Mohawk Council does have, through our donation policy, which is administered through our executive services, we provide $1,000 to the family of a lost one, of a loved one, lost of a loved one. That is available to all members. Also, the community support program provides some assistance as well, provided that the individual does meet certain criteria for that assistance. They don't have to be a social recipient, but they do have to meet certain criteria to be able to provide some financial resources. I will say at the beginning of the pandemic, the $1,000 that's made through executive services, that was increased from $500 earlier on in the pandemic. Just recognizing that the costs have gone up as well. That we be able to, in the past, people were able to support one another in other ways, or to provide financially, or we were able to donate food, things like that help fray some of the costs. But because of the pandemic, people weren't able to. So we increased that to $1,000 at this point. Those are the two pots of money that are available through the MCA for community members who have lost a loved one.
All right, so I'm going to wrap up with you in 5 to 10 minutes. So we're going to close the phone lines. Mohawk Council of Akwesasne, Grand Chief Abram Benedict on our program right now, and we will wrap things up by 1:10 this afternoon. At the latest, any questions we do not get to, I will make sure that we pass those along to the Grand Chief's office. So keep that in mind. Now, looking at some other items for the Mohawk Council of Akwesasne, is there anything happening with regards to any new housing? Anything happening regarding any new rental units? Things of that nature.
So we will be doing our regular applications for new constructions that we would normally do. We do have a couple applications into Canada Mortgage Housing Corporation, who is a funder for our rental units that we have in the community. I do believe that a couple of those are on the verge of being approved. I don't have the particulars on them, but anybody who's looking for some additional information can reach out to one of the district chiefs, and they would be able to provide a bit more information. I will say, though, that one of the things that we have been challenged by, if anybody who has paid attention or has gone to a lumber yard or tried to build anything, the costs have gone up a lot, astronomically. We're probably looking at 1.5 times more than, or half times more than it was last year, or before the pandemic, to build. So this, unfortunately, will also have an impact on us as well. That if we are successful in our applications for new constructions, the money's not going to go as far as it used to, which will just mean that we'll have to build less, or that we'll have to find some additional resources to put into those projects. So while I know housing continues to be a priority for us and a need of the community, this year may be a little bit, we may not build as much just because of that. I don't expect that these prices will continue to be forever, but this year likely they will be, and that will have an impact on our decisions and what we decide to construct for the community.
Now, looking at Akwesasne, I know that we announced this week some good news for Akwesasne, that they were removed from outbreak status. So a shout out to everybody at Akwesasne for sure.
Oh, absolutely. It's great. I mean, we had went in outbreak status, and then we had come off, and then we went back in, and now we're off again. And it's a call for a celebration in itself, because our facility being in an outbreak, which means either one staff or one client or resident have tested positive, and in order to come out of outbreak, that means that they've had to have a period of time with negative results, meaning nobody is positive for COVID, and we have achieved that. And you're giving a shout out to them. We need to give them a big shout out because it's not been easy for any one of our healthcare workers, and they're keeping our dudas safe, and we greatly appreciate that.
For sure. Also across the river to our friends and loved ones over at Akwesasne again. You guys just work so hard to make sure that our loved ones are safe, and making sure that you're safe for your families and things like that. So it's a chain reaction when we have such dedicated employees that that take care of our dudas and therefore everybody else down the line. How are we doing with medical transports? Are those still being made available? And how do people access that service?
Mhm. To my knowledge, they continue to be made available. We do have the ones that we provide transportation for, but as well, there's one of the programs provides resources for an individual who drove somebody out. So that program still continues to be available to our community members. If there is anything that other than that, I encourage them to reach out to the Department of Health Administration and get an update. But as far as I'm aware, that those services still continue to be offered.
All right. So with that, we're going to wrap up. And like I said, if I didn't get to anybody's question, I will make sure that it gets forwarded to the Grand Chief's office for sure. Thanks to everybody that phoned in. So Grand Chief, we're going to have you wrap up for today's program, please.
Absolutely. Well, thank you as always, Reen. I really do enjoy coming to CKON and providing an update to you in the community and taking all of the questions that the community has. I don't have a problem with that. And if we don't have answers, or if I don't have answers, we will get those answers to you. As always, thank you for joining in this afternoon and listening into our update. It's been a year. Simply hard to believe. I know we've been coming every month, and in the beginning of the pandemic every 2 weeks, but saying we've been 3-4 months, we're 12 months, we're a year now since this pandemic has started, and it's been very tiring for all of us. And we've been doing the best that we can, and I appreciate everything that the community has been doing to keep ourselves and our community safe, embracing all of the health recommended for the precautionary measures. And, as always, we have to just continue to take this one day at a time and continue to support each other. Our community is doing great. We have been able to ward off the high number of cases. We have to just continue to exercise patience. I know that as we get more people vaccinated, more people are getting more anxious and ambitious to do more of the things that we used to do. But we need to continue to just exercise a little bit more caution, a little more patience and caution, because we're getting there. We, it's been a long time coming for a vaccine. We need a little bit more time, and thank you everybody who has been patient and has gone out to get vaccinated, and we're continuing to do the rollout and to keep us safe. So as always, Yango Areen, to you, CKON, and all of our staff keeping us and our community safe in our community. As always, thank you for joining in, and hopefully in about a month's time, we'll provide another update to you in the community. So happy St. Patrick's Day, and enjoy the rest of your day.
You too. Thank you very much. Be safe, Grand Chief. Thank you.
Thank you, Maureen.
97.3